Hi, my name is CJ Devgan, and welcome to Season 2 of Breaking Barriers. My goal for Season 2 is to discuss how digital transformation is redefining how care will be provided in the next 5, 10, and 20 years. I will be talking to leading minds in the healthcare sector and exploring how new disruptors are leveraging technologies such as artificial intelligence, population health, blockchain are reshaping the healthcare universe. Hello and welcome back to another episode of Breaking Barriers. I will continue my conversation with Jacques Lirette, Senior Director, Executive Services at Infotech Research Group.
I had a pleasure of attending a conference last Friday, which was focused on analytics and artificial intelligence. And there were a lot of sharp minds presenting at that. And one of the questions that came up was the same question. Why, when artificial intelligence, the fuel to artificial intelligence is data, and free flow of data between different systems and different entities is key. Why we are not getting that? And there were some senior government regulatory individuals at that. And the point that they mentioned was the ownership of data. The challenge, the biggest contention that happens is that people don't want to share data. I was talking to one of the physicians over there, and he mentioned a scenario where a kid had a trauma, went to a hospital, they did a CT scan, they found some real challenge for the kid, so they transported that kid over to sick kid hospital. They transported the kid, but they didn't send the scans. So now, even though the whole hospital staff was ready to operate, there was a delay caused because now they had to do again all those scans on that kid, which was insanity from my perspective. But again, that interoperability of data is lacking, and a lot of reason is who owns that data? Do entities have trust on each other? What kind of security, what kind of privacy do you need to have that data being flown? And you're right, financial data is a lot less complex than healthcare data. And the privacy, because of the negative ramification that can be caused by leakage of that data, a lot worse. Therefore, a lot more stringent regulations have to be around that. Especially the HIPAA in US has been very, very stringent, and a lot of penalties get applied. So there has to be something that needs to be done. So let's talk about now the disruptors that are out there, like blockchain, that can have that ledgers being encrypted and that trust can flow. What kind of trends are you seeing that can help us remedy these challenges in next 10 to 15 years?
It's interesting. Blockchain has a lot of promise because it has the ability to identify, document who and what entities are looking at a specific amount of data and do transactions and record it. And I mean, I was at a conference last summer about the future of blockchain and where all the different kinds of opportunities were. I do believe that healthcare is going to benefit from blockchain. I don't think it's going to happen in the near term because healthcare is usually a laggard in adopting new technology. It needs to be proven in other sectors first. Because healthcare is just risk adverse for the right reasons. But if you look at blockchain, I think that's an interesting area where that technology can be used to secure transactions and authenticate transactions. Because the biggest thing about unauthorized access is authentication. And we do have a lot of issues regarding identifying the right provider to be able to show that information that's in the systems. So I think that blockchain is one. The other area where I think we're going to see some development, you mentioned AI. I think the challenge for the infrastructure healthcare system that we have today, which is in Canada, which is public, we're going to see some pressure from virtual services that are going to come online using AI. As soon as you have enough data to be able to do a diagnosis, AI will be able to diagnose patients on certain things probably better than human beings can. So we might see services coming out from the private sector that you can go online and fill out a form, or I don't know what the future holds, and the system will come back to you and say, hey, why don't you do this? And maybe you've got this. And I know that may sound scary, because if you talk to providers today, they're going to say, wow, AI is really promising, but it's never going to replace us in the near term. And if you talk to people, or if you talk to individuals, what they want is access. They just want access to care. So whether it's online, which is what they're used to now, or they go physically somewhere and you make that easy, it's all going to be about access. So I think AI is going to play a big role in improving the efficiency of the healthcare system, even assisting providers in delivering faster and better and more accurate care, and more care plans that are dedicated to a specific genome or specific DNA. So we're going to see treatment change as a result of AI. So I think AI is going to play a big role in the future. The other aspect that one of the trends that I'm seeing is the amount of data that's being collected by individuals. So if you think about the fact that you've got millions of people walking around the world with smartwatches that is collecting biometric data from the person that's carrying it in almost real time, and that's all being collected by companies such as Google and Apple and some of these big firms that are producing this technology. All that data is going somewhere, and it's not going into the public domain. It's going into the private domain. But all that data is going to be, at some point, you would think somebody's going to want to leverage that data for either good or evil.
So let's not go into evil side, but even from good perspective, there's a lot of counter arguments on that as well. I was reading an article recently that indicated, how do we authenticate the data, A, and how do we ensure that data is accurate, So that's another philosophical debate that is going on. You mentioned about wearable devices that people are wearing, and recently Apple got an approval for their ECG. But the question is that ECG done at physician office under controlled environment, would physician provide their care based on that data, or the data that is coming from a wearable that they are doing at home, and we don't even know under what circumstances and how authentic that data and how accurate that data is?
That's a really interesting question, because as the technology evolves, the data is getting more and more accurate. And I would challenge the regulatory bodies to be able to certify equipment in such a way that we would know, based on the certification of equipment, whether that data is accurate or not. So if you think about I'll go use the ECG example. So let's say that if you walk into a hospital or a healthcare provider and you get an ECG, there's a piece of equipment there that's been built by X, Y, and Z that has been certified either by Health Canada, or it's been certified by the FDA, or it's been certified by some standards body that makes sure that it's been tested. And as wearables become more and more advanced and more capable, there's no reason why those devices can't be certified as well. And the question of accuracy, there's always going to be errors, but for the most part, as the technology refines itself, it just gets better and better. And there's going to be different kind of healthcare events in your life that require a higher level of accuracy. The fact that I'm wearing a watch that's measuring my ECG, the only time that this would need to be accurate is if I'm having a cardiac event and my watch basically recognizes I'm having a cardiac event, and it notifies the authorities or first responders to come to me because something just happened. That's a very different circumstance, because you're dealing with an episode of care, as if you're just managing trends. So if my watch is measuring my ECG, and all of a sudden I go to my primary care physician and say, oh, by the way, here's my last 6 months worth of ECGs. Is it 100% accurate? No, there might be reasons why it's not, but it's good enough to trend. And in healthcare, when they treat patients, there's two types of well, maybe there's more than two, but the two primary ones is as an episode of care. So if something's wrong, you need to go get it looked after. That's when you walk into the healthcare system. So you go see your hospital or you go see some kind of practitioner. And then there's the other kind of care, which is just preventative. You're taking care of yourself. You're going for your annual physical. You're doing your regular blood test. So that's more on the maintenance side. I think on the maintenance side, your data doesn't need to be as accurate all the time as an episode of care. Does that make sense?
Yeah, I agree with you. I'm a big proponent of preventive care because the episode of care at acute care is the most expensive. When it can be dealt at PCP, it's a lot cheaper. And if it can be dealt at home, then our cost will come down drastically. And that is what these preventive and predictive devices will allow us to do. And hence, we are seeing a lot of product development. If we look at last 6 years worth of data, I read somewhere that there was, on average, 47% year-over-year growth in new product development in the space of wearable devices. So this is a trend that is definitely here to stay, and it will transform. It will transform the way care will be provided. A well-being of a person will be monitored and improved in coming years. So I completely concur with you on this.
And the one challenge that the healthcare system as a whole is going to have, and we're already starting to see it, is the amount of data. Right, the amount of data that's being collected. There's a startup in Toronto that is building it's already beyond prototype, and it's a blanket that when you put it on a patient, it monitors ECG, temperature, movement, and the sensors are built into the blanket. So when you put that in a hospital, all of a sudden you've got a bunch of data that's collecting in real time that needs to go somewhere. And if you make more and more devices in your healthcare institutions collect that data, you need to store it, manage it, secure it, analyze it, respond to it. So there's all this work that needs to go that I'm not sure the healthcare system is ready to handle.
I completely agree. And that is why the topic number one that we were discussing, data, because we all acknowledges that there will be a truckload of data that will get generated by various devices, and by different entities and vendors. How do we improve interoperability? Which means if there's a data sitting at a PCP versus hospital versus Google versus Amazon versus Fitbit, it can interoperate and it can get transmitted and received by these entities. A. B. How do we trust that they are data for that patient and not for someone else? And C. We can ensure the security of that data. That people are not going in and changing values and then getting it into the care continuum, and people now starting to do diagnosis on incorrect data. And then the final one is privacy, that data does not get leaked and get into those evil hands that we kind of now want to talk about on this chat today, at least. So those are, in my mind, 4 pillars that will establish the way data is going to be consumed by people. So who owns the data? How do we ensure the patient has control over where and how the data is shared and used? Is the question that I think is paramount and must be answered in coming months and years for this whole thing to take shape.
I totally agree. This whole question about custodian of the data and the source of truth is one that's going to be, or is, an immense challenge, because if you ask who owns the data, you'll get, the majority of the time you'll get an answer, it's the patient. But in reality, the patient it may own the data, but they're not the custodian of it. And it's this battle between the ownership and custodianship that makes it difficult to share data. If you have organizations that are custodian, by that they are responsible for securing privacy, make sure that nobody has inappropriate access, and that's an immense challenge. And it continues to be and will continue to be probably the biggest challenge when it comes to sharing health information.
I agree. The end of the day, it all needs to translate into a longitudinal record for that patient. And if the data is sitting in disparate systems and we are not able to generate that longitudinal record for Chiranjeev Devgan, then it is of no real benefit for Chiranjeev Devgan. When anyone who's providing care for Chiranjeev cannot see data for Chiranjeev, then that transparency and that benefit will be lost. That's where I think we need to go. So let's talk about other opportunities. So 5G, what is your take on 5G? And how do you see 5G impacting and transforming healthcare?
I would think, well, I don't even know where to begin, because 5G is going to be transformative for sure, but not because of just 5G, but it's what 5G enables. So if you looked at and I've have had the opportunity to work with some startups here in Toronto, and even some of the work that's developing around the world, is that this connectivity is going to provide high bandwidth, high availability, and very low latency networks, which means that you can control and manage devices remotely and large numbers of them. So if we go back to the conversation about the smartwatch, well, in a world that right now there's technology being developed that's not just watches. It's going to be in your shoes, it's going to be in your shirts, it's going to be in your clothes, it's going to be in your glasses, it's going to be, so all this embedded technology that's going to communicate data is just going to grow. And it's going to be available in large numbers and in large areas. So if you think about all of those developments that are happening on the IoT side or the Internet of Things side, on the healthcare side, there's going to be so much technology being built because of the bandwidth capabilities to transmit data real time. You'll be able to build a device, which are being built today. You'll be able to build a device that'll collect some kind of information, transmit it back to a data center, which will be able to process, analyze that data, and then tell the device to do something. So imagine if you're a diabetic and you have an insulin pump that you monitor personally every day and you're looking at that. Well, think about that in a world where you won't even need to look at it. It'll be measured based on your biometrics, and the insulin pump will just do what it needs to do based on AI because of all that data that's going to be sitting up in the cloud. The devices don't need to have a whole lot of intelligence. They just need to be able to communicate to something that does. So it changes the way that devices will work. And in the medical world, right now, those devices aren't connected and they're all over the place. And in the very near future, they will be connected and they'll be collecting all this data and they'll be able to improve the quality of care because of it. Medication dispensing is one. It could even be something that is wound care. If you've been wounded and you need to measure your wound succession, you'll have bandages that'll be connected to a device that will monitor how well you're healing. There's all kinds of technology being dreamed of right now that is being prototyped that 5G will enable.
Fantastic. This reminds me of Star Trek.
It just goes to show you, right now you have devices that need to be connected to a very high bandwidth network in order to operate medical diagnostic equipment that will be able to be put into a smaller box, because we're now able to do, and it'll just be mobile. And if you think about things that are physically connected to something in a hospital, it'll be able to be remote and it'll be in a smaller case.
Okay, so next topic that I want to discuss after 5G is telemedicine. So what do you see the future of telemedicine in 2040?
I'm going to just put my kind of creative hat on to answer that one. One of the things that we need to kind of understand is that the world population is growing at a pace that is unsustainable in the sense of building traditional healthcare delivery. You can't build hospitals for all these people, and the public purse isn't deep enough to continue building hospitals the way we built them. And so we're going to need to rely more on telemedicine, if that's the word that we're going to use today. I'll call it virtual medicine in by 2040. The other aspect of that is the amount of people we need to train, our physicians and our care providers and the people that are providing care today. Again, we're not training enough of them. There's a shortage of clinicians today. So imagine when the population is growing around the world, what you're going to see is this virtual medicine coming out of, maybe it won't come out of Canada. Maybe it's going to come out of the developing world, where they've got more facilities to train, supplemented by AI. I'll be able to look into a camera. The camera will do a scan of my biometrics and say, okay, it looks like you need this, this, and this, and we're going to prescribe it to you, and then Uber delivers it to my door.
So moving along to the next topic, the next one is telemedicine. What do you think of telemedicine in 2040?
That's an interesting question, and I think I'll put my creative hat on, because it's more of a personal prediction, probably more than anything else. But I would say, if you think about the world population trends right now and how the population is growing, not only growing, but also migrating around the world. So in Canada, we're growing mainly by immigration, and we're seeing these populations come into Canada. It's unrealistic for us to expect that we're going to be able to build similar infrastructure today that we have today to meet the demand of healthcare in the future. So building hospitals and building more facilities is probably not something that the public purse can continue to fund. So the way we deliver care is going to change, and it's going to change. Instead of being telemedicine, I'm going to call it virtual medicine, where you'll have access to providers and care in the digital world as opposed to physical world. And it's going to change the way practitioners practice, and it's going to change the way we consume basic healthcare services. You will still need facilities for acute services, but I think in the very near future, you're going to start seeing a transformation of primary care delivery to the virtual world. The other aspect of that is that we're now seeing an aging population on the clinical practitioner side, and it's not realistic in Canada or even in the Western world to expect that we can replace all those care providers that are going to be leaving the profession or retiring with sufficient growth to handle the new demands of healthcare. So we can expect that we're going to see pressure on the providers as well. This is where I believe AI is going to supplement those providers in a greater capacity. As well, those developing nations, mainly in the Far East, where you have a lot of population and education systems that are able to support more providers, you might see some of our care being delivered offshore. So I see that the technology is going to become more and more capable of diagnostics, collecting personal data, providing better primary care services on the management side to people without having to interact with the physical system.
Interesting. So we are getting to our final bottom of the hour. And I really, really want to thank you for your valuable time and sharing your experiences with our audience. As we wrap our call, any final words, things that you see happening within our healthcare space, the way care will be provided, any challenges that we need to overcome?
The first thing I would like to close with is that I'm pretty optimistic about the way that the healthcare system is going to evolve with digital transformation. And I believe it's primarily going to be driven out of the consumer as opposed to the system. The system is going to have to catch up. The one concerning note that I have is the political landscape today is very divided, and there's lots of opposition on imposing change and trying to bring the healthcare system to where it needs to be. And I find that political system is not really addressing what the population is looking for. So I think that there's some more consumer pressure that's going to come to bear that's going to make it so the system will transform itself. I don't think that the transformation is going to come from within. It's going to come from external forces. But I'm excited by all these developments and the technologies around how to better manage my own care. And I think it's going to make it easier for us to manage care for ourselves, our children, and our aging parents. So it's going to make it easier with the advent of all this technology. I'm a little concerned about where that data is going to sit and where it sits in private hands. And I hear a lot of conversations around that today with all the things that are in the news. But I think those will be resolved. I think governments will put legislation in place to protect privacy to the best of their ability, because they can't always keep up. But I'm optimistic. I'm optimistic that this is going to be a good thing for the health of our population, and especially those who are in areas where they can't afford to have these high acute care facilities. The technology is going to bring some good care to them.
I completely agree with you, Jock. I do believe that patients need to have more control over where and how their data is stored and used. And I do agree with you that government agencies need to set out a clear patient-centric, patient-friendly policies that lays the groundwork for how data needs to be shared, it needs to be used, it needs to be managed. With that, I want to thank you again for sharing your insights, the various conversations you're having with the decision makers, both on Canadian as well as on your side, and your time.
Well, thank you for having me. This was very fun to do.
Thanks. Pleasure is all mine.
That is all for today. Thank you for listening. If you are a healthcare executive and grappling with challenges to transform your organization, contact me and let's talk. If you like our show, please subscribe, leave a rating and a review for us on iTunes. Ciao and have a productive week.